All right, so today we're going to dive into some pretty heavy stuff,
Yeah.
You sent over some excerpts from a Dr. John Campbell YouTube video where he's talking about a speech by Robert Kennedy Jr.
Yeah.
And it's all about, the state of health, specifically in the U.S. and the U.K. It's really interesting.
Yeah. This is a deep dive for sure.
Yeah.
What I find particularly interesting is how Kennedy Jr. connects these health trends we're seeing.
Yeah.
The influence of corporations.
Right.
And even corruption within health agencies.
Yeah.
It really makes you think.
It does.
Are these just personal choices?
Right.
Or is there a bigger system at play
Right.
that's shaping those very choices?
It's a really good point, and something that I think we should definitely unpack.
Yeah.
Now, both Dr. Campbell and Kennedy Jr. use some pretty strong words to describe, what's going on.
Right.
Like epidemic, even pandemic.
Yeah.
When they're talking about the rise of preventable diseases, they're saying it's a full-blown health crisis.
Those terms,
Yeah.
while dramatic, aren't entirely unwarranted.
Yeah.
When you look at the statistics,
Yeah.
they're saying that 66%
Oh, wow.
of American adults
Yeah.
and Latino children
Yeah.
are grappling with at least one chronic health issue.
66%. That's crazy.
It is.
Especially when you think about it, 50 years ago, that number were less than 1%.
Yeah.
So what's
changed?
That's the question, right?
Yeah.
What's changed so drastically?
That's the million-dollar question.
Yeah, in the past few decades.
And it's not just a general uptick.
Right.
Across the board,
Right.
we're seeing specific and alarming trends with certain diseases. Well, obesity, prediabetes, fatty liver disease.
Right.
Even neurological conditions like ADHD and autism are seeing increases in diagnoses.
It's an explosion of these conditions.
Yeah.
What's fueling it?
Now, Kennedy Jr. brings up this personal anecdote that I think really drives this point home.
Okay.
He talks about how when his uncle, JFK, was president, juvenile diabetes was practically unheard of.
Wow.
Now it's a pretty common diagnosis.
That's a stark contrast.
It is.
So what does he attribute these changes to?
Well, he points the finger largely at two major culprits.
Okay.
The rise of ultra-processed foods and the increasing prevalence of environmental toxins.
Okay.
He even makes a rather bold claim.
What's that?
That scientists from the tobacco industry were brought in by food companies to engineer addictive qualities into their products.
That's kind of disturbing.
It is a bit concerning.
It's like they took the playbook from Big Tobacco and applied it to what we eat every day.
Think about it.
Yeah.
Ultra-processed foods.
Yeah.
Packed with sugar.
Right.
Unhealthy fats.
Yeah.
Artificial ingredients.
Yeah.
It's a concoction our bodies aren't really designed to handle.
All right. It goes against our natural biology.
Yeah.
But it's not just what's in the food.
All right.
It's also what's on our food and what's in our environment more broadly, like pesticides, food additives, pharmaceutical. All these things can disrupt our hormones and contribute to health problems.
Yeah, and he highlights a specific example of this
with
the concerning trend of early puberty, particularly in the U.S.
Okay.
The data shows girls are reaching puberty on average 6 years earlier
6 years
than they did in 1900.
Wow.
That's a massive shift.
I knew it was happening earlier, but I didn't realize it was that drastic of a difference. It makes you think what kind of impact that has, not just physically, but emotionally and socially for these young girls.
Early puberty is a complex issue
Yeah.
with far-reaching consequences.
Yeah.
And the potential link
Right.
to hormone-disrupting chemicals in our food and environment
Yeah.
is worth investigating.
For sure.
Yeah.
But, both Dr. Campbell and Kennedy Jr.,
Right.
they go beyond just identifying the problems.
Yeah.
They actually point to corruption within the very agencies that are supposed to be safeguarding our health
Right.
as a major contributing factor to this crisis.
That's where things get really intriguing.
Yeah.
They're suggesting that agencies like the FDA, USDA, and the CDC are far too entangled with the industries they're supposed to be regulating.
They're calling it a conflict of interest.
Right.
And they even give some examples.
Yeah, Dr. Campbell mentions Professor Jerry Gitch,
Yeah.
who developed a promising cancer treatment
Right.
using bacteria. that was actually denied a license.
Oh, wow.
By the UK's regulatory agency.
It raises some serious questions.
It does.
About whose interests these agencies are truly serving.
Yeah.
The public's health.
Right.
Or corporate profits.
It's a question worth pondering.
Yeah, it's a pretty hefty accusation.
It is.
Makes me wonder if these agencies are truly equipped to protect us.
Right.
If they're potentially compromised by these conflicting interests.
It's not just some fringe theory.
Right.
These are accusations being made by credible figures.
Exactly.
With a platform.
And when you consider the sheer scale of this health crisis, it really underscores the impact of this alleged corruption. I mean, we're not just talking about individual health here. We're talking about the health of entire nations.
That's a crucial point.
Yeah.
And beyond the human cost,
you're right.
There's a massive economic burden as well.
What do you mean?
Well, chronic diseases cost the U.S. economy at least $4 trillion annually.
Wow.
To put that in perspective,
that's
5 times the military budget.
5 times?
Yeah.
Wow.
Just imagine how much money could be saved and redirected.
Yeah.
If we focused on preventing these diseases.
Yeah, instead of just treating them.
In the first place.
Right.
Rather than just treating them after they develop.
It's a staggering thought.
It is.
And it really highlights the urgent need for a systemic shift in our approach to health.
Moving away from a reactive sick care system to a proactive model that prioritizes prevention and well-being.
From the start.
Yeah.
Okay, so we've painted a pretty bleak picture so far.
We have.
But I know both Dr. Campbell and Kennedy Jr. Offer some potential solutions, right?
They do.
We're not just going to leave our listeners hanging with all this doom and gloom.
They emphasize the importance of changing incentives within the healthcare system. We need to move away from this model.
Yeah.
That only rewards treating illness.
Right.
And start rewarding keeping people healthy.
It's like we're incentivizing sickness.
Exactly.
Instead of health right now.
They also advocate for creating healthier food environments. Making nutritious food more accessible and affordable for everyone. And finally, they stress the importance of individual empowerment. Encouraging people to take control of their own health. Through lifestyle changes.
So it's a multi-pronged approach.
It is.
We need to change the system itself, but also empower individuals to make healthier choices within that system.
Precisely. It's about creating a world where health is not just an afterthought, but a core value embedded in every aspect of our lives.
That's powerful.
It is.
From the policies our governments create to the food we choose to put on our plates each day.
Exactly.
That's a powerful vision. It really gets to the heart of what this deep dive is all about.
It really makes you think, doesn't it?
It does.
What would it look like
if
our society truly prioritized health and well-being?
That's a great question to ponder, honestly. It's a bit mind-blowing to imagine. But let's come back to Kennedy Jr.'s assertion that there's this potential corruption within these health agencies. Can you break that down a little further for me?
Sure.
How exactly does that corruption manifest?
Well, you know, Kennedy Jr. and critics like him argue that it's often a case of regulatory capture. This means that these agencies who are tasked with protecting public health can become unduly influenced by the very industries they're meant to regulate.
That seems like a recipe for a conflict of interest.
Exactly. And you can see this influence play out in a few ways. One is through lobbying efforts. Powerful industries pour money into lobbying campaigns to sway policy decisions in their favor, sometimes at the expense of public health.
So it's about money influencing policy.
Often, yes.
And
then there's the issue of the revolving door phenomenon.
What's that?
This is where people move back and forth between working for government regulatory agencies and working for the industries they were previously regulating.
I can see how that could potentially create a problem.
It can blur the lines and raise questions about allegiances and objectivity. And then, of course, there's the issue of campaign financing. Corporations often contribute heavily to the campaigns of politicians who then have the power to appoint agency heads and influence policy decisions.
So it's a complex web of influence.
It is.
You've got lobbying, revolving doors, campaign financing. Sounds like it could be very difficult to disentangle.
It certainly presents challenges, but it's crucial
Okay.
To be aware of these potential conflicts of interest.
Okay.
So we can critically evaluate the information we're receiving from these agencies and hold them accountable for truly protecting public health.
It's about transparency and making sure the system serves the people, not just the corporations.
Exactly.
But this all feels very big picture systemic.
It is.
What can we as individuals do to make a difference?
Well, sometimes it can feel overwhelming.
It can.
When you think about these large-scale issues.
Right.
But I firmly believe
that
individual actions do matter.
Okay.
And they can collectively create ripples of change.
Okay, so give us some concrete steps.
Sure.
What can our listeners actually do starting today to move the needle on this?
One of the most impactful things we can do is become more informed consumers.
Okay.
We've touched on this already, but it bears repeating. Don't just passively accept the information you're given.
Right.
Especially when it comes to your health.
Yeah.
Do your own research. Read labels carefully.
Right.
Understand the ingredients in the products you're buying.
Okay.
Support companies that align with your values.
It's about being mindful and making conscious choices.
Precisely.
Yeah.
Another key action is to get involved in the political process.
Okay, how?
Vote for candidates who prioritize public health over corporate interests.
Okay.
Contact your representatives.
Yeah.
Let them know you care about these issues.
Okay.
Support organizations that are fighting for change in the food system and for stronger environmental regulations.
It's about using our voices and our votes to advocate for the changes we want to see.
Exactly. Now let's talk about lifestyle changes.
Okay.
This one might feel a bit more personal, but it's equally important. Focus on incorporating more whole, unprocessed foods into your diet.
Okay.
Cook at home more often.
Yeah.
Experiment with new recipes. Find healthy options that you actually enjoy.
So it's not about deprivation or following some restrictive diet. It's about finding sustainable, healthy habits you can stick with.
Exactly. Get moving.
Okay.
Find an activity you enjoy, whether that's walking, dancing, swimming, whatever brings you joy.
Right.
It's not about punishing yourself.
Yeah.
It's about honoring your body.
Right.
And moving in ways that feel good.
Those are all great points.
Yeah.
And remember, you don't have to do everything perfectly from day one.
Right.
It's a journey.
It is.
And small changes can make a big difference over time.
Absolutely. And one thing I've found incredibly helpful on my own health journey is connecting with others who share similar values.
So find your tribe. Connect with people who inspire you to live a healthier life.
It can make a huge difference.
Yeah.
In terms of motivation and accountability.
That's a great point.
Yeah.
And don't underestimate the power of conversation.
Oh, absolutely.
Talk to your friends and family about these issues.
Yeah.
Share what you're learning. Raise awareness.
Yeah, you never know who you might inspire to make a change.
That's such a good point.
Yeah.
We can all be agents of change
right.
in our own way.
Absolutely.
Just by having these conversations and spreading awareness. But one of the things that really struck me in Kennedy Jr.'s speech was his emphasis on the financial impact of this health crisis.
Right.
It's not just a human tragedy, it's also an economic burden.
That statistic about chronic diseases costing the U.S. economy at least $4 trillion annually.
That's insane.
It's really hard to ignore.
5 times the military budget.
Yeah.
It's mind-boggling to think about.
It is.
Just imagine how much good we could do.
Yeah.
If even a fraction of that money was invested in creating a healthier society.
Imagine the research we could fund.
Right.
The education programs we could implement. The access to healthy food we could provide.
It's a completely different picture.
Yeah.
It makes you wonder why we aren't prioritizing these things.
Yeah.
Preventative health measures more.
Yeah.
When the benefits are so vast.
That's the key question.
Yeah.
And it brings us back to this issue of these potential conflicts of interest.
Right. Are the policies being shaped by what's best for public health?
Right.
Or by the financial interests of powerful corporations?
That's a tough question to grapple with.
It is.
But it's a question we can't shy away from if we truly want to see a shift in our approach to health.
Right. And that's where individual action comes back into play. by becoming informed consumers, by advocating for policy changes, by choosing healthier lifestyles, we can start to shift the balance of power.
Absolutely.
It's about taking back our health, both individually and collectively.
Exactly.
Yeah.
And it's not just about ourselves.
Right.
It's about future generations.
Speaking of future generations, one of the most concerning things in this deep dive for me has been the rise in childhood illnesses.
It's heartbreaking, isn't it?
It is.
To see the statistics on obesity, diabetes, neurological conditions in children.
And to think that so much of it could be prevented.
I know, it's really tragic.
It underscores the urgency
it does.
of addressing these issues now.
We have a responsibility to create a world where children can thrive.
Right.
A world free from these environmental toxins and unhealthy food environments that are contributing to this crisis.
A world where their health and well-being is truly prioritized.
It's a vision we should all be striving for. You know, we've spent a lot of time talking about the problems, but I think it's important to remember that we're not powerless in this situation.
Okay, good.
You know, there are things we can do, both individually and collectively, to create positive change.
Okay. I like where this is going. I'm ready for some actionable steps.
Okay.
Some hope to balance out all the heavy stuff we've uncovered.
So what are some concrete things our listeners can do?
Yeah, starting today.
One thing Kennedy Jr. advocates for is rooting out corruption within those health agencies.
Right.
We were talking about earlier. Now, that might seem like a daunting task.
It does.
For an individual.
Yeah.
But there are ways to contribute.
Yeah, like
supporting organizations that advocate for transparency
Mm-hmm.
and accountability in government is a good place to start.
So it's about finding and amplifying the voices that are already working to address these issues at a systemic level.
Exactly. And don't forget the power of your vote.
Right.
Supporting candidates who prioritize public health and who are committed to tackling corruption can make a real difference in the long run.
It's about taking that individual action.
Right.
And using it to influence the larger system.
Precisely. Now, remember Kennedy Jr.'s point about changing the incentives in healthcare?
Right.
We can all play a role in that, too.
So how do we do that?
Right. It's not as simple as just flipping a switch.
It feels a bit abstract.
But there are concrete things you can do.
Okay.
For example, talk to your doctor.
Okay.
About preventative health measures.
Okay.
Ask about screenings. Lifestyle changes. Alternative therapies.
Okay.
Support policies that expand access to preventative care.
Right.
And make it more affordable.
So it's about being proactive with our own health.
Right.
And pushing for a system that supports that proactivity.
Exactly.
Yeah.
And let's not forget the role of education and awareness.
Okay.
The more we understand about how our bodies work, the better equipped we are to make healthy choices.
Right.
Read books.
Yeah.
Listen to podcasts.
Right.
Talk to experts.
Knowledge is power.
Exactly.
The more we know, the more empowered we are to take control of our own health.
And share that knowledge with others.
Yeah.
Have conversations with your family and friends about the things you're learning. You never know who you might inspire.
It's like we were saying earlier.
Right.
About being agents of change in our own way.
Absolutely.
Those conversations can plant seeds.
Yeah.
And those seeds can grow into something powerful.
Absolutely. Now, let's not forget Kennedy Jr.'s third key step.
Okay.
Inspiring people to get healthy. This one might seem more straightforward, but it's often the hardest part.
It's about those lifestyle changes.
It is. Yeah.
We were discussing earlier.
Yeah.
Eating healthier, moving our bodies, managing stress.
Yeah.
Those things are simple in theory.
Right.
But they can be challenging to implement.
They can.
In our busy modern lives.
Yeah, you're right. It's not always easy.
Yeah.
But here's the thing.
Okay.
Small changes can make a big difference over time.
Right.
You don't have to overhaul your entire life overnight.
Right.
Start with one small habit you want to change.
Okay.
And focus on that.
So maybe it's swapping out that sugary soda for water a few times a week.
Yeah.
Or adding an extra serving of vegetables to your plate.
Exactly. It's about progress, not perfection.
Right.
And remember, you're not alone in this journey.
Yeah.
Find a support system.
Yeah.
Connect with people who inspire you to live a healthier life.
There's strength in community.
There is.
You know, sharing recipes. Yeah.
Exercise tips. Even just words of encouragement can make a huge difference.
Absolutely.
In staying motivated.
And remember, taking care of your health is not selfish.
Right.
It's an act of empowerment.
Yeah.
It's about honoring your body, your mind, and your spirit.
It's about living your best life.
It is.
And that's something worth striving for.
Absolutely. And one final thought I want to leave our listeners with.
Okay.
Don't underestimate the power of hope. It can be easy to feel overwhelmed.
It can.
By the scale of the problems we're facing.
Right.
But hope is what fuels action.
Hope is what keeps us going.
Exactly.
Even when things feel challenging.
So as you move forward from this deep dive, I encourage you to hold on to that hope, that belief, that we can create a healthier future for ourselves and for generations to come.
So, listener, what will you take away from this deep dive?
Yeah.
What action will you take?
What conversation will you start?
Yeah.
Remember, you have the power to make a difference.
Until next time, stay curious.
Right.
Stay informed.
Yeah.
And stay hopeful.